assuming I got them right. We're not sure. Okay, so we're going to go through them. I'm just going to put an automatic timer, and then we'll go through the answers at the end. If that's all right? Everyone good to go? Or do you want to look at a minute? Good to go? Yeah. Cool. So either will be accepted. More common than Cushing's disease, and there's no comment about any visual changes. If they were without any more information, they'd tell you about visual changes with the disease, or you pick the more common option if there's not more details in the picture. Okay? So Cushing's syndrome, usually steroid related, investigate with dexamethasone suppression tests. Okay? BT? Yeah. Easy. So barium swallow and esophageal carcinoma. Again, you can get similar looking swallows with different types of esophageal dysmotility issues, but you'd be less likely to get the weight loss and swallowing difficulties, given that would be more of a cancer history. What do you think? Yeah, meningococcal septicemia, and 3 priorities following ABCD and cannulation. Okay, I just heard mumbling. So, fluid resuscitation, blood cultures, and IV antibiotics. Would we LP this woman? No. So she's got signs of septicemia. You can risk introducing that into the meninges if you LP her. Okay?
This is going to sound like a really stupid question.
Yeah.
But if you were to write more than 3 things down, would you get the points if 3 of them are right?
I assume they'd mark the first 3.
Right.
Well, that's what we've been told by previous F1s. Obviously, no one knows the actual mark scheme, but I would assume they'd mark the first 3. Okay. Is there a question? No? Okay, so a 78-year-old woman presents with lower back pain. Diagnosis? Vertebral compression fracture. And 2 treatments. Can't hear me. So calcium and vitamin B supplements and bisphosphonates. These are normally managed conservatively. It's very rarely that you do X fix things that stretch things out.
Is that the same thing as a wedge fracture, do you reckon you get the mark if you raise
You probably get it for a wedge fracture.
Okay, thanks.
Okay. What's the diagnosis? Basal cell carcinoma. So pearly nodule, telangiectasia, I can't say that word, but edges, rolled, normally on the face. They don't normally metastasise, but they are locally invasive and destructive, so if you don't treat them, they just nibble and eat away at the area. So they need excising. What's the diagnosis? Extradural. And what 2 drugs would be given? Vitamin K. Does anyone know doses? 5 micrograms, oral or IV? IV, yeah. And what else? No. You can get, yes, Octaplex or Veriplex or whatever, so clotting factor concentrate. So high INR guidelines are, if you've got an INR of 6 to 8, but no signs of bleeding, just stop the warfarin. If they've got an INR over 8 with signs of minor bleeding, give them vitamin K. If they've got any serious or major bleed, which includes intracranial pathology, you need to give them clotting factor concentrates like Veriplex, Octaplex, whatever they can use, and vitamin K.
Could you just first, like, complex?
Yeah, so you can have vitamin K, Octaplex, Veriplex, or clotting factor concentrate. This was possibly the most controversial of our ones last year. Everyone either thought it was Gottron's papules and dermatomyositis or tendon xanthoma. Nobody could quite agree. So tendon xanthoma, statins as a cause, and hyperlipidemia. So this is a left bundle branch block. If anybody said an ST elevation MI, you can't have that. If someone's got a left bundle branch, you can't comment on the ST or the T wave. Unless he's got previously known left bundle branch block and he doesn't come with chest pain, this is ACS. On our exam they asked us for two investigations you do, but I don't actually know what the defined second investigation actually was. So I've only asked for one. I put echo, other people put different things. Okay, what's the diagnosis? Acute pulmonary edema. What's the cause? Wait a minute, here we go. Cardiac arrhythmias? The DNB is relevant if they give you something in AKI. So, acute pulmonary edema, AKI secondary to pre-renal failure. If they give you something in the question, it's relevant. DNB wouldn't give you a high potassium, it'd give you a low potassium, unless you've got a related renal failure. And 2 treatment options for a chest. There's obviously more than 2. 100% oxygen, unless they've got contraindications to it. IV frusemide. Do people know what the dose of IV frusemide in pulmonary edema is? 40 to 80 milligrams, unless they normally take it, in which case you'd think about doubling their normal daily dose. You need to follow that with GTN spray, and if they've got a systolic above 100, a GTN infusion if they're not improving. Apparently we don't have photos later than sort of the 1970s or 80s of any thyrotoxicosis. And this woman comes up a lot. So thyrotoxic storm or thyrotoxic crisis. She fits the criteria not just for thyrotoxicosis alone. And it's precipitated by infection, non-compliance with medications, and radioiodine therapy. So any 2 of those. What's the diagnosis? Shingles. And what treatment does she need? Acyclovir after 4 days. Analgesia. Acyclovir is only indicated within 72 hours unless they're immunosuppressed, got ophthalmic shingles, or they're pregnant. Then they can have it within the first week. So she just needs good analgesia. If you give acyclovir, you give a 7 to 10-day course, but very few people get it. What's a really common complication of shingles? I can't hear, sorry. Postherpetic neuralgia, was that what people said? So people have, people have pain in the site of the dermatome for like weeks to months. It's really, really common. Tend to get gabapentin and the like, and it sometimes works as an effect. Diagnosis? Non-proliferative diabetic retinopathy. We got a couple of icons on ours last year. I can't quite remember what they were. So what's in the picture? Diabetic tophi. So it is gout, but they're specifically pictures of tophi because you can see. Maybe it doesn't project very well, but they have got little. You can see all the white bits of the fingers. And what's the likely cause of the abdominal pain? Renal stones. Okay. What type of renal stones will they be? Yeah. And how do we treat acute gout? NSAIDs are first line, contraindicated or not tolerated. Yeah. What's the diagnosis? Yeah, diverticular disease or diverticulosis, not diverticulitis. There's no signs of infection. And what two symptoms would you expect in a flare? Left eye fossa pain and diarrhea are the most common two. I don't know whether you probably get it for abdominal pain. People do get bloating, people do get blood in their stools, but the most common two things are left eye fossa pain and diarrhea. Anyone presenting with diarrhea in the right age group needs to think, so over 50 need to consider diverticular disease. Do we give antibiotics in diverticular disease? If they've got signs of complications, so even if they've got signs of infection, so like raised inflammatory markers, they don't necessarily need antibiotics according to papers. They just need it only with complications, so things like fistulae, things like they're not improving over a couple of day course, but most people settle down within 48 hours. Dermatitis hepatiformis, and what condition? Celiac. Celiac disease. Excellent. And then, last of all, so there is a partially compensated respiratory acidosis, and there's also type 2 respiratory failure. I only read one up, but so you can have either of those. Differential? Infective exacerbation of COPD, because he's got cause papules and a localised sign. If he was just wheezing or cracks all over, you'd be less sure. And 3 initial treatments. I've put 4 up here. You can have any 3. What oxygen concentration would you start this person on initially? 10%. So 24-28%. They're already hypercapnic. They've got a low O2 and he doesn't save on any oxygen. So you're going to try and creep his oxygen up without banging his CO2. You need a repeat blood gas after an hour unless it deteriorates quickly. That's it.